Hey everybody, Dr. Chanel here from inTune Chiropractic, and today we're talking about hip flexors and all of the different things that entail low back pain along with hip flexor pain and what's really the root of the cause of the problem that you might be having. A little disclaimer before we jump on in. Please do not self-diagnose at home. Please make sure that you are being diagnosed by your physician, chiropractor, anybody who has that authority to diagnose you is the one where you should be getting that full diagnosis from. If you have questions, we can help. Please come into our office and we can diagnose you here. So why I say that is because some of the exercises and stretches that we're going to go over today are going to be for patients who have specific problems that we know of. And if you're doing these exercises and stretches at home and you might not have that as your issue, it can make what's going on in your body worse. So please know that and understand that self-diagnosing is not helping you, and come on in and let's get you diagnosed. So we're chiropractors and everybody thinks we're only low back pain doctors, and that is not the case. But most people come into the office with low back pain. And when that happens, we look at the body as a whole. We can go from it being anything in the lumbars, the pelvis, the knees, ankles, hips. Now, a lot of times we're seeing in our powerlifters, our CrossFitters, and our athletes that they're getting this low back pain and it's coming from their hip flexors. But on the flip side, our truck drivers and our long haul drivers who are sitting in their cars all day in that 90-degree flex position are getting a lot of that low back pain. Now, with our virtual learners, and it's a new category and we're all figuring out how the body needs to deal with all of the stress that's going on at home, we're also seeing a lot of our virtual learners are having the same hip flexor problem, because during the day these kids are getting up and normally running around with their friends, they're fidgeting, things like that. But at home they might be getting into a different routine, a different sitting position, and not really being able to maybe not get up as frequently, or they're just sitting all crazy and we're just trying to get through the day. So we can help with that as well. So many of you are probably thinking at this point, what is a hip flexor and why does it hurt my low back? So a hip flexor is what has the ability to bring your knee to your chest. So it allows that motion of knee to chest. Now, when that happens, a lot of people can get pain in the front of their hip, or they'll feel that pain in the back of their hip. And think about it, when you're sitting all day, you're constantly activating your hip flexors. So your hip flexor muscles are your iliacus and your psoas major muscle, along with your rectus femoris. When your iliacus and your psoas are put together, it makes your iliopsoas muscle. And that is a really deep muscle in the body, and it's very hard to find and really pinpoint. And that's something that we pride ourselves in being able to do as chiropractors. And here we really pay attention to what's going on with your iliopsoas muscle, because that can lead to a lot of malfunction in the pelvic floor, along with low back and different things like that. Now, after sitting for long periods of time or overactivating that muscle by doing a lot of squats, deadlifts, things like that, you really have to make sure that your form is proper when you're squatting and deadlifting. So you can cause muscle fatigue after even sitting for too long. That can happen. You can cause sprain strain of the muscles. You can cause impingement of the hip. There are so many things that you can do to damage your tendons and ligaments in your body, and we just got to figure out which muscles it's happening to and how to fix it. Okay, so let's talk about one condition that you could possibly have. Like I said in the beginning, please do not self-diagnose. This does not involve everybody if you have this problem, so make sure that you're being diagnosed properly and correctly by the right people. But let's begin with the hip flexor strain. So that can lead to a multitude of different things that we have to do. First, we need to figure out if it's exactly a strain. Then we have to grade it. There are 3 grades when it comes to hip flexor strains. There's grade 1, 2, and 3. A grade 1 and a 2 we can treat in office with conservative chiropractic care, and that is an amazing result that we get from chiropractic care, is we can help heal those the strains in the body and do the right things to know when to stretch, when to strengthen, when to leave alone, when to adjust. A grade 3 is not something that we will deal with in office. We will refer you out because most likely you might have to have surgery. So don't freak out. Most of the people that we see 1 and 2. It just kind of depends on how well your body will heal and how fast you will heal, along with which grade and step you're at. Okay. Let's talk about the grading system. Grade 1, minor. Very minor tear. Think of it as a new hole that kind of created in your pants. You can kind of see it, but you still see all of those fibers nice and connected. It's just starting to fray a little bit. That would be considered a grade 1. Grade 2. Now think of that hole as you can see your skin through the pants. You still see the muscle fibers attached, but you see a significant amount more of your skin through that hole. So, meaning those fibers are severely damaged, moderate to severely damaged, and they're creating a decrease in ability to flex the hip. So you're really having a difficulty in bringing that knee to your chest, and there's not a lot of range of motion in that hip. Grade 3. Now think of that hole as there are no fibers that are connecting through there, and it's just completely a hole at this point, and that's a full rupture of that tendon or ligament. And essentially the only thing that's going to put that back together is by having surgery. Like I said again, most of our patients do not have that, and we would refer out for a grade 3. Also, in a grade 3, you're probably walking with a limp along with not even really being able to walk. So, like I said again, don't fear, it's probably not a grade 3. Now, another condition that you could possibly have is called hip impingement. And there's a huge difference between a strain sprain and a hip impingement. So a hip impingement is when you're getting that pain in the front of your hip area, and you feel it every time you get into a nice deep squat. You feel that pain immediately when you're at the lowest, deepest point. And you'll feel it right in that front, and then when you stand up, it kind of goes away. That is a hip impingement. And that's very different from a sprain strain. Now, with a sprain strain, you'll feel it on that affected side, but you'll feel it after sitting for too long. It can travel and radiate to your low back. There's just a ton of different things that can show up with a sprain strain. So let's talk about what we can do in office for all sorts of hip mobility and treatment. First of all, you'd come in, we'd examine the whole body, the low back, the hips, the knees, the ankles, everything. Because of that chain in your body, we like to look at everything as a whole and break it down from there. So as we go through, we decide exactly what's going on, and we give you a diagnosis as to what could be the source of your problem. There are a few things in office that we can do, and adjusting is great. It helps kind of get that mobility back into the joint and allows us to be able to get up and move around a little bit easier. Then what we'll probably recommend for you is a piezo wave treatment. Now, our piezo wave is exclusively to our office here in Mount Juliet, and what the piezo wave 2 does is it allows blood flow into that area, and tendons and ligaments are really hard to get blood flow to. So what this does is it floods that area with blood and new cells, and it allows the healing process to naturally kick in. Non-invasive, no downtime. We tell you to go ahead and work out, go for a run, do what you normally do, because we believe here that keeping your body active and moving is the thing that keeps you the most healthy. After we adjust, run some piezo wave, maybe tape you. We do a lot of taping in the office to help kind of stabilize after we do adjust, especially in that rehabilitation stage. Now, there are many forms of care. There's relief, rehab, pain management. There are ways to do wellness care. There's so much of a variety with chiropractic care. It just depends on patient to patient and what we believe you need in our office for you. So most of our patients with the hip flexors, we start out with a nice adjustment, some piezo wave, and probably some taping. As we move through treatment, we will then get into showing you some strength and stretching exercises that you can do at home, but we'll also do some of them here in the office. Our biggest thing is knowing when to strengthen and when to stretch, and we're gonna show you in the next few clips a few exercises and stretches that you could do at home. A lot of our patients, if you've been sent here by us because you need this at home, pay attention to these next few clips. During the heel drag, you're going to force the foot into the ground by pushing your heel down and making sure that you just slightly drag it up towards the butt and then back down all the way flat. During this leg lift, you want to make sure your core is tight, but that you're using your hip flexors to lift the leg to a 45-degree angle. For this, you're doing it slow and controlled for a resisted hip. You can start without bending the knee, and then you can go ahead and bend the knee up. Make sure you're placing the foot all the way back down and bringing it all the way back to that 90-degree angle. So in the office, we like to do some functional testing while you're in your first appointment, and we do some orthopedic tests along with different functional movements. We love to watch our patients squat because that can tell us a lot about how you're actually using those muscles and you're moving properly. So I'm going to show you a few functional tests that we do in the office on your first appointment and on your re-exam. We've got Dr. Al here to help me out and show you a few of our functional movement tests. So you're going to sit on the edge of the table, and what I'm going to have him do is we're going to say that his right side is the affected leg where he's finding that pain. So for that right side, he's going to grab that knee and pull it to his chest. Now he's going to rotate back and lay on the table. Good. So you see how his hip comes almost directly touching that table. His pants might be a little bit tight, so that might be adding to the inability to fully get hip flexion here. So you can go ahead and relax. So now if that test was extremely positive, what would happen is this leg would come up off the table and you would see a clear disconnect between the table and his legs. So let's go ahead and show them that. Bring your knee to your chest. There you go. So this would be a very positive Thomas test, meaning that there is hip sprain. Okay, so now for hip impingement, he's going to bring this leg to his chest. And then he's going to filter over that other side of the body. And if it's a positive for hip impingement, that pain will be right in the front part of his hip. Another thing that you can kind of test to figure out if it's hip impingement is have them go into a nice deep wide squat, and we'll show you what that looks like next. So now we're going to have Dr. Al go into a nice deep squat. And the pain would be right in the front part of the hip and come back up, and it would be right there in that deep part of that hip. And you'd feel it really when at the bottom of that squat, that's when that pain would hit.
Hey guys, Dr. Al here. I'm going to talk quickly about knowing the differences if you need to either strengthen your hip flexors or if you need to stretch your hip flexors. Because if your hip flexors are weak and you're constantly day in and day out just stretching them, you're not really helping your problem, and your problem might even get a little bit worse, and vice versa if you need to really stretch those hip flexors because they're too tight and you're doing a lot of strengthening exercises, you could possibly be making them even more tight. So there's a quick at-home test that we're going to show you right now with Dr. Chanel, and it'll tell you if your hip flexors are weak and you need to strengthen or if you need to stretch. All right, you guys, Dr. Chanel's here is going to show you kind of the quick at-home test so you can see if your hip flexors are either tight and you need to stretch or if they're weak and you need to strengthen. So what you would do is grab one of your knees and bring it all the way up to your chest. Bring it up as far as you go, because as you know, the hip flexors kind of activate your hip to bring it up towards the chest, even past that hip height. So what you would do now is you would let go, and if your hip and knee stay at about the same height as they did when you first brought them up, that means your hip flexors might be a little bit tight and you're going to have to do some stretches. But that's a good thing. That means they're strong, they're not weak, and we're not going to have to do any strengthening. So showing you again, bringing that hip all the way up to the chest, and then letting go of your hands. If the knee drops a significant amount that it was before you let go of it, that is a sign that your hip flexors are weak and you would need to start doing some strengthening exercises for that. I would do this exercise on both sides to kind of test both of those hip flexors. And it's easy as that to find out if those hip flexors are weak or if you need to strengthen, or if they're too tight and you kind of need to do some stretches.
Let's reiterate a few things. 1, please do not self-diagnose. We want to make sure that you are being diagnosed properly and by a professional, not just by watching videos and trying to figure out what you are having going on, because it could be the wrong thing and you could be actually doing more damage to your body than you could be if you just came in and saw us. 2, hip flexors have a lot of things to do with low back pain, knee pain, ankle pain, when you're squatting, if you are a long haul driver, if you're a virtual learner, and even if you're an athlete or pregnant. There are so many things that can go on with your hip flexors, so make sure that your doctor or physician is checking you as a whole and not just what you're saying is wrong. And lastly, thirdly, we hope you enjoyed this video. Please like and subscribe and follow us on all of our social media platforms, and we can't wait to see you next time. Bye, guys.